let's talk about Impetigo. If you're a parent, you've probably heard of it. It's a super common, super contagious skin infection, especially with little kids. But here's the good news. It's also very, very treatable. So in this explainer, we're going to break down what it is, what causes it, and exactly how to handle it. Okay, take a look at this. This right here is the classic look of Impetigo. You see those signature honey-colored crusts around the mouth? That's the dead giveaway for its most common form. It's such a distinct look that for a doctor, it's a huge clue right off the bat. So what's actually happening here on a microscopic level? Well, impetigo is a bacterial infection that hangs out right on the surface. It only affects the epidermis, which is just the very top layer of your skin. It usually kicks off as these little blisters or pus-filled spots that break open, and that's what leaves behind those crusts we were just looking at. All right, this leads to some pretty big questions, right? What's causing this infection in the first place, and who's most likely to get it? Let's dive into the factors that can leave our skin a little vulnerable. Now, this is where it gets kind of surprising. The culprits are actually bacteria that most of us have on our skin all the time with no problems. The main one is Staphylococcus aureus. You've probably heard it called staph, but sometimes it can be Streptococcus pyogenes. Yep, the exact same bacteria that causes strep throat. Or you can even get a mix of both. So if these bacteria are just hanging around, how do they suddenly cause an infection? Well, it's all about opportunity. Think of your skin as a protective wall. All it takes is a tiny crack, like a little cut, a bug bite, or a patch of eczema, for them to sneak in. And that's why we see it so often in kids, especially between ages 2 and 5, and why it pops up more in hot, humid weather, where bacteria just love to grow. Okay, so it turns out not all impetigo looks the same. It's usually broken down into 2 main types, and knowing the difference is really key to understanding what's going on. First up, you have non-bullous impetigo. This is the classic version we've been talking about, with those telltale honey-colored crusts. But then there's bullous impetigo. This one's a little different. It's caused by a specific toxin the staph bacteria releases, and it creates these big, floppy blisters. It's not as common, but you see it more often in newborns. And this picture shows the difference perfectly. On the left, you've got the crusty lesions of non-bullous impetigo. Then on the right, see those big, clear, fluid-filled blisters? That's your bullous impetigo. Seeing them side by side makes the contrast really obvious. So now that we know what to look for, how do doctors actually diagnose it? And more importantly, how do we get rid of it? Let's walk through the game plan. You know, one of the interesting things about impetigo is that a doctor usually doesn't need any special tests. They can typically identify it just by looking at it. The appearance is that unique. It's only in really stubborn cases that they might take a swab just to be 100% sure which bacteria they're dealing with. The treatment strategy is really pretty straightforward. It boils down to 3 clear goals. Number 1, gently clean and remove the crusts so the medicine can actually get to the skin underneath. Number 2, use antibiotics to kill the bacteria that's causing all the trouble. And number 3, and this one is critical, do everything you can to stop it from spreading. So the go-to weapon here is antibiotics. If it's just a small patch, the first choice is usually a topical antibiotic, a cream or an ointment that you put right on the spot. But if the infection is all over the place, or if it's that blistery, bullous type, then the doctor will likely prescribe systemic antibiotics, pills, or a liquid that fights the infection from the inside out. So why is it so important to get this treated quickly? Well, if you just leave it alone, the infection can actually burrow deeper into the skin and cause a more serious condition called cellulitis. And in very rare cases, if it was caused by strep, it can lead to a kidney problem. But it's really important to remember these complications are uncommon, and treating it early is the best way to make sure they don't happen. And that brings us to maybe the most powerful tool we have, prevention. Let's talk about how to stop impetigo before it even starts, and then we'll tie it all together with a quick, real-world example. You know that old saying, an ounce of prevention is worth a pound of cure? Well, with impetigo, it could not be more true. The absolute best defense is just simple good hygiene. And it all starts with the most basic thing in the world, washing your hands. So what does that really mean? It means being diligent, washing hands frequently, keeping fingernails cut short so bacteria can't hide out under there. A big one is not sharing personal stuff like towels, clothes, or razors. And if someone in your house does have it, keeping those sores covered with a bandage is absolutely key to stopping it from spreading to everyone else.
Okay, time for a pop quiz. Let's put this all together. A 5-year-old walks in with those crusted sores around their mouth. They say it's a little itchy, but otherwise they feel fine, no fever. What are we thinking?
And here's how it plays out. The diagnosis is clearly non-bullous impetigo. And the management plan is exactly what we just talked about. A topical antibiotic cream to knock out the infection, along with some solid advice on hygiene to keep it from spreading or coming back. Simple and super effective.
All right, so we've gone through the causes, the different types, and the treatments. After all that, what is the single most important thing you should remember from all of this?
It's this. Impetigo can look a little alarming, I get it, but there is no reason to panic. It is an incredibly common, very contagious infection, but it's also just on the surface, and it's easily beaten. By focusing on good hygiene and following through with a simple treatment, you have everything you need to stop it right in its tracks and keep your family healthy.